Hi there, Dr. Alan Christianson here. Do you need to take an antibiotic? I'm going to give you some easy ways that'll help you answer that question so you'll know confidently. Of course, they're terribly overused, they're getting less and less effective, and we're getting more resistant germs. But at times you feel awful and you're desperate, and you've got a big presentation, maybe you're traveling, maybe you're going to be going on vacation, and you just can't be sick a few extra days. So what do you do in that moment? How do you make the decision? Well, here's the easy rule. This is the rule of one. So you want to think about your ears, about your throat, your lungs, and your sinuses. Okay, so we've got 4 areas: ears, sinuses, throat, lungs. Now, when you've got symptoms in a mixture of areas, you've got a virus. So painful, sore, congested ears, maybe things sound a little funny, sounds kind of come and go, runny nose, some pressure, sore throat, tickling cough, heavier cough, some chest pressure. So you mix all that up, you got a virus. Now you mix 2 or more of those up, you've almost certainly got a virus. Whenever you see symptoms in more than one area, that's usually viral. Now here's the optical illusion about a lot of viral infections. You've got, symptoms are going to last for 7 to 10 days. And first few days, they're not too bad. You're kind of like, oh, I'm noticing it. Maybe I'm not quite right. Then you get in the thick of it and you're feeling really awful for a bit. And what'll happen is, it's when you first start feeling awful that you start questioning it. So a few days into feeling awful, now we're probably on about like day 7 or 8 out of 10, that's when people typically seek out medical care. And they say, hey, look, I'm done with this. This has gone on for too long, and I just need to have this gone. So again, we're about day 7 or 8 out of 10. That's when they get the antibiotic. And in the next 2 days, they magically get better. Remember, it was a 10-day thing. It's typically a 10-day issue. And so often to the doctor and to the participant, it seems like the antibiotic fixed it. But it really did not. It would have gone along and stopped in that time frame anyway. So if the symptoms are more localized, here's the times to where they really are indicated. If you've got strongly localized symptoms to your throat, to your ears, or to your lungs, sometimes that could warrant antibiotic treatment. Not as common for adults, but some do get complicated ear infections. If they have that, they won't commonly have a runny nose or a sore throat. It's going to be more so the ears and then some fever and some pain. Also, strep throat does happen, and that does really benefit from treatment. We see that when there's not a runny nose, there's not ear pressure, there's not a cough. It's just a bad, painful throat in most cases. So more localized, could be bacterial, could need treatment. Now to the lungs and the chest, very productive cough, fever, fatigue, probably not a sore throat, not a runny nose, no big ear pressure. That could be pneumonia. That does take a chest x-ray to confirm. Listening is not perfect in most cases, and that does benefit from treatment. Now, if you were watching really close, you might notice that I broke the rule in one area, and that was the sinuses. So I didn't say just symptoms here need antibiotics. There was a big paper in the world of otolaryngology, all the ear, nose, throat experts, and they looked at people that had full-blown sinus infections, like confirmed with CT, like no debate about sinus infections. And they put them in a couple of groups. One group got antibiotics, one group did not. Now they tracked how long the symptoms lasted, which was important, but they also tracked how many times those people got sick per year afterwards. So the old advice was sinus infections could take a long time to get rid of, so you probably need 2 courses of antibiotics. That's what I was taught, and we heard that in many levels of training. Well, what we now know is that sinus infections take about 3 weeks. And if you take an antibiotic, it'll take about 3 weeks. If you don't take an antibiotic, it'll take about 3 weeks. There's no difference whatsoever in how long your symptoms last. But here's the rub. If you do take an antibiotic, your odds of having more sinus infections that year are 50% higher than if you did not. So if you do take an antibiotic for a sinus infection, it won't go away faster, but you've got a good chance of getting sick sooner than you would otherwise. So rule of one area, throat, lungs, ears actually do need it. I'm not against antibiotics, but by very conventional guidelines, they're not at all helpful when we're seeing a mixture of symptoms, like common bronchitis or common colds or influenza or flus. And one last note about the flus, there is Tamiflu, there is a treatment for the flu, which is kind of like an antibiotic against influenza. The data is really strong that it's not helpful. If you were to treat someone in their first 12 hours of being sick, their illness might go away 5 to 10 hours sooner. That's it. And that's at the cost of some substantial potential side effects. And the variety of types of flu are resistant to it. So that's when you need an antibiotic, usually not. One of my favorite tricks, this is a fun thing. So viruses we shed through sweating more than anything. So kids, they get sick, they get a crazy high fever, they're miserable, and they're done, right? They shake it faster because they can mount a stronger fever response. That's how their body gets rid of the virus. As adults, we don't have the vitality to mount that kind of a fever, or we don't give ourselves the space to rest and do it. But you can make that happen in a short period of time. So the recipe is you get some ginger tea, you make a real hot bath, and you get extra blankets on your bed, and then a whole lot of warm sweat clothes. So socks, sweatpants, sweatshirt, maybe even a wool hat, like silly amounts of clothes. And this is something you do at bedtime. So get the tub filled up, get it pretty hot, but tolerable, but pretty hot. And jump in the tub for about 15 minutes and work on some warm to hot ginger tea. Now, ginger is a diaphoretic, which means it helps you sweat things out faster. So it's also going to warm you up internally. So once you've cooked yourself pretty good in the tub, put on all the clothes, jump in bed, extra blankets, go to sleep. Here's how it plays out. Typically, after a few hours, you've sweat really hard and you're pretty warm. Throw off the extra clothes, go back to sleep, totally fine. But in so many cases, you will wake up and you will have kicked the virus. You will be feeling better and you will have broken the cycle of it. So that's a stronger antibiotic for most common respiratory infections, and it won't cause side effects for you. Thanks for hanging out with me. I'll be back with you real soon.